Samantha Redding. I'm one of the advanced clinical practitioners for urgent community response for South Warwickshire University Foundation Trust, and this is a video about a day in the life of urgent community response in South Place. So we start the day at 8 o'clock, we cover an 8 till 8, 7 days a week, 365 days a year. The ACPs work 8 till 8, some of the other team do flexible working, just so we're covered throughout the day. 8 o'clock in the morning we start with a bronze meeting, which is a collaborative meeting of managers and clinicians from acute and community services. 8:15 we have a West Midlands Ambulance Service collaborative meeting, and at 9 o'clock frailty meeting with our acute colleagues and an acute frailty consultant, and we've got a virtual ward that we also help administer for admission avoidance and facilitated discharge of patients.
I just wondered if you'd be able to see an 81-year-old lady for us.
Can you give me the NHS number, please?
Well, if you were able to visit her.
Yeah, okay. We will.
And then you can always feed back to us, and we can decide if we need to involve them. Thanks so much.
Cheers. Bye-bye.
Cheers, bye-bye.
Bye.
So as you can see, Heather's just taken the referral from Consultant Connect for this patient who's asthmatic in respiratory distress. So I'm going to go out and do an assessment of this lady now. My name's Joanna Pearce. I'm one of the advanced clinical practitioners for urgent community response working in South Warwickshire, and I work mainly in the community. So we've just had a referral from Consultant Connect, and this is from one of the GPs out in our local area who is concerned about a patient who is in respiratory distress. This person could possibly have to be admitted to hospital, so we try and go out and see if we can intercept and see if we can help keep this patient at home, give them the right treatment at the right place at the right time, basically. So we're off now to go and see this patient, where I'll do a full assessment, probably take some blood. We have a good relationship with the Path Lab. We're an integrated trust and we have a fast turnaround. They normally give us our bloods back within 2 hours. So if the bloods indicate that there is any need for us to do any interventions, any treatments, that they're showing that there's some deranged bloods and things like that, we can act on it quite fast. So once we get a referral, we have a 2-hour response and a same-day response, depending on how urgent it is, whether we need to see that patient urgently or it could be within the same day.
Hi, my name's Grant. I'm a physiotherapist. I work for the Urgent Community Response Team. So if a patient has issues with mobility or they need equipment and adaptations, that's why we're involved. When we ring up the triage referral, we'll ask, about equipment existing in the property, and also about the mobility level. And then from that we establish, okay, we'll need to take out a wheel Zimmer frame, we need to take out a commode, whatever we've got installed covered, we can take out, because that's part of being an urgent service.
Hi there, I'm Sophie, clinical specialist for therapy within the Urgent Community Response team. So I work as part of the multi-skilled UCR team to help prevent unnecessary hospital admissions. So as therapists, we're able to conduct thorough health and social care assessments to determine the needs of the patient. We're able to respond to patients within 2 hours or 24 hours, depending on the level of urgency. So we might be called out to somebody who's had a fall. That's somebody who's fallen without any sort of apparent serious injury or loss of consciousness. Or we might be called out to somebody who's at a very high risk of falling. We may also be called out to somebody who's just had a very rapid decline in their mobility or functioning, and we're able to organise same-day delivery of equipment to keep patients safe at home. We also sort of work very closely with other members of the UCR team, so the ACPs, nurses, so that there's sort of a holistic approach to the patient's care.
So referrals come from all different services. It's a non-exhaustive list, but generally from general practitioners, from 111 service, from the ambulance service after 999 calls when they've been redirected. Patients can self-refer, but usually when they've been guided to through 111, they've got the single point of access number, and then that goes through to our clinical call centre. We also get referrals from acute. Sometimes that's for admission avoidance, but also facilitated discharge. And we also have self-generated referrals from our district nursing teams, therapists, and other such services too, when they go and recognise that somebody's in a deteriorating state.